neurological system, but I'm also on musculoskeletal, but I'm also center, because what I'm doing is I'm looking at the skin color on the center of the baby's body, okay? I'm looking at muscle tone, and again, I will just test by doing this. I will test the motor reflex again. So it's just doing this and let go. And the baby, and then you say, oh, come on, baby, oh, come on, baby. And at this stage, I'm going to, oh, and I tested for the grab reflex, okay, which forms part of neurological system, okay. Then I ask the mother, mommy, just hold the baby's hands quickly so I can put my stethoscope on. And then I put my stethoscope on. And then what I will do, okay, I will listen to the baby's heart rate. I'm not a cardiologist. I'm not going to listen for abnormalities, okay. Unless I'm worried that the baby has a fever, then this baby will, I'm not going to put it, because I think I'm too loud. I can't hear myself when it's in my ears. So just listen to the heart rate. You can take the pulse, okay. Then, and this is, so it's heart. And also when I did this hand, arm strength, muscle tone, motor reflex, grab reflex, I also did a capillary refill check, okay, which forms part of cardiological system, okay. And remember, capillary refill, you press the fingertips for 3 seconds, let go, and see if the blood fills back within 3 seconds, and you count. How long does it take for the blood to fill? So can you see that none of these things are really isolated, okay. So now I'm going to listen to the baby's breathing. So I did cardiological already, okay. Now I'm doing the baby's breathing. So what you do, you divide. So now I'm asking mommy, just hold baby's arms. If this is the baby's lungs, guys, now I can't draw lungs very well. I think I just drew a liver. Okay, so here is, this is right, my right, no, who's right? This is my right and left. So wait, let me do it, let me draw my side, otherwise I'm going to confuse you. So the airway is coming from the top like that. Can I borrow your pen quickly, or a pen?
Any pen?
Yeah, let me just show you what to do. Okay. Then so sorry, the airway is now coming from that side, ne? So the right lung has how many lobes? 2.
2 lobes.
And the left lung has 3 lobes. Okay. But both of them have an upper and both of them have a lower. So what you do is you listen for airway entry on the right lung, upper right. Compare that with upper left. Then you go to lower right, compare that with these 2 sounds, and then compare the lower right with the lower right, lower left. Okay, so I'm going to do that quickly. Okay, so just hold the baby, and now I listen to the baby's lungs. Okay, I'm there on the chest. So I listen for a few breathings, and I listen for crepitations or wheezing. I listen for any sounds in the lungs, and then I note that, okay? And then I go to, so that was the right side of the baby, upper lung. Then I go to the left upper lung, and I compare the 2 sounds and air entry, and I compare if it's the same or not. Then from there I go to the lower right, listen for air entry, and lower left, okay, and I compare. A baby that has aspirated in milk will usually have a lower right crepitations, and that's why it's important to listen. And if you are worried about the baby's nose, patency of the nose, then you put your stethoscope on the nose and you listen for air entry, and you'll hear. Okay, and that's a little bit of a blocked nose, and then you give health education on the blocked nose. So then we've done lungs, né? Also together with respiratory system, I look at the nose for nasal flaring, and I look for tachypnea. Okay, a normal breathing rate for a new baby is about 30 to 40. Okay, for the heart rate is about 120 to 150 beats per minute, and it reduces as they grow older. Okay, so now I'm going to go down to gastrointestinal. So can you see how we flow? Nee. And now I listen for abdominal sounds. Okay, so I listen, and what is it that I can expect to hear?
Bowel sounds.
Bowel sounds beautiful. I'll hear the peristalsis. I'll hear gas maybe, and that is what we want to hear. Okay, and then again we'll tell the mother, sure, your baby's tummy is nice and soft or working very well, and then I palpate. Okay, you can also palpate the breasts, the nipples, and if it is swollen, you know that is normal. Okay, if there's umbilical cord, which forms part of cardiologic system but also gastrointestinal, have a look, see, is it dry, is it moist, is it mucky or anything like that. Okay, then I keep the nappy between the baby's or under his buttocks. Okay, and I move down to the legs. Okay, and so I observe the nappy area. If it's a baby girl, look at the majora labia and minora labia. Look for a discharge. Look for, if it is a male child, then you will have to palpate the scrotum and feel if you can feel or palpate a testicle on either side. Look at the penis and see where the opening of the urethra is. If there's any abnormality, you have to refer that baby. Okay, now I'm moving down, and I'm almost giving a little bit of a pull on the baby's legs at this stage. I also feel for bilateral strength, muscle tone, and then I'm going to look for the reflexes. Okay, so you push your finger under the baby's toes, and you want what reflex? This is the plantar
plantar.
Yeah, okay. So you put your fingers, don't do this with the poor baby, it will bring all the more back for you, okay. But you put your fingers under the toes, but I do it here, it's just for you to see now. Put your fingers under the toes, and you need to see that reflex where the baby's toes curl around your finger. Then you move downwards to the heel, then you get the Babinski reflex, okay. And then what I do is I turn the baby around, hold the arms. If there's body fluid, take it away. Have your own baby wipes, clean it, okay, take away. Then pick the baby up, okay, and feel the spine, or you can put the baby down on his tummy. That's also what I do. And I see if he has neck control, is he moving his head to the side, okay, to protect himself. But you would need to see an intact spine, and you also at the same time look at the skin for any nappy rash or anything like that. Okay, turn the baby around, okay, and then you just put the nappy back. So a clean nappy, preferably if the mother has one. Take the baby's body temperature. If your room is cold, by now he will be crying and he will be cold. Okay. So that is endocrine system. Okay. So did I miss anything, guys? If I look at my form, I didn't make. Okay. So, and that's the physical assessment. Let's just quickly do a walking reflex quickly, which we're not going to get on the doll. Okay. So if this is with a small baby, up to 6 weeks of age, 5 to 6 weeks, then you check for the walking reflex. So you hold the baby upright, let the soles of his feet touch the base of the bed, and let him feel where he is, and he will start to do the walking reflex. And it's supposed to disappear by 6 weeks of age, okay? And then when the baby does the walking reflex, and you tell the mother, wow, your baby is so clever. Okay, and then that's it. So you can, if you want to continue, maybe do another recording, Glenn, because then we can just go through this document quickly. Because there's some things that I haven't done, which is on here, but I'll tell you where it fits in. So you can close for now.